Whole Health Pharmacy Partners and the University of Toronto have partnered together to design a virtual appointment-based model for community pharmacy practice to support physical distancing during the COVID-19 pandemic. So what is the appointment-based model? It is a proactive approach to filling medications with two key components. The first part is medication synchronization, aligning all of the patient's refills to be filled together on one scheduled date at a regular interval. The second part is a scheduled patient-pharmacist appointment on the day of the synchronized medication refill pickup to optimize medication needs and provide clinical services. ABM can help increase medication adherence, uptake of clinical services, and reduce pharmacy work. The first appointment-based model in Canada has been implemented by Whole Health Pharmacy Partners, who are an innovative banner of independent community pharmacies. So why implement ABM virtually? Well, due to the COVID-19 pandemic, healthcare must shift virtually to eliminate unnecessary exposure, decrease pharmacy foot traffic, alleviate workload pressures, and ensure pharmacy access from home. So in order to find out how it would be most feasible and effective to implement ABM virtually, literature searches were conducted on PubMed, Ovid, and Google Scholar, looking at virtual pharmacy services, existing virtual ABMs, video versus telephone consultations, and patient technology preferences. This would ensure that the new model would be evidence-based and acceptable to patients. So what did we find out? There are no publications currently available regarding virtual ABM implementation due to the pandemic, but there is evidence supporting pharmacists delivering virtual care, such as med reviews and telemonitoring. Studies show telephone-based ABM was effective in identifying and addressing DTPs, improving adherence rates, and refill rates. Looking at phone versus video, evidence shows they are equal in quality and length, but video experiences more technical difficulties. Looking at automated reminders, evidence showed that they improve refill rates, appointment attendance, and patient satisfaction. Looking at technological preferences for adults over the age of 55, 89.4% of patients chose phone over video consultations. Barriers to video include difficulty hearing, such as with hearing aids, difficulty seeing, such as reading text on screen, cognitive difficulties, such as trouble remembering passwords, and poor computer literacy. So taking all that information, we decided that phone calls would be the main virtual platform for virtual ABM due to their low cost, little impact on workflow, and patient preference. The initial medication synchronization, all prior phone calls, and the main appointment itself would all be done via telephone. Synchronized medications would be delivered to the home of the patient, minimizing non-essential travel for vulnerable populations. The Wellness Plus manual was updated to include the new virtual model for implementation. Once the virtual ABM is implemented at Whole Health Pharmacies, the next step will be evaluating its efficacy and patient perception. With the new virtual ABM, we would repeat the same study parameters as the in-person ABM study and compare the two models. In addition, it would be beneficial to create a patient survey to assess their perception of the virtual model. Thank you for listening to this presentation.